I'm very impressed by the fact that there is now a national strategy for health literacy in Germany, and that Christine Sorensen had some small role in helping the local people to set this up. It's very impressive. There aren't many countries who are doing that. What I would like to start with is to actually be a little bit challenging to Jonas and say on behalf of you and your colleagues, it's a really excellent and innovative example of health education reaching out in a way that some health education, public health, doesn't do in other countries. I mean, for example, in my country, often the customers, if you like, the citizens will say they feel they're being talked down to. I think this is being addressed now with new programs for the National Health Service. But just to come back to you, Jonas, what have you learnt from your customers that allowed you to change and improve your product?
On the one hand, they have very specific questions, and then it's difficult for us to answer all these different things. And yeah, provide in a way, some people think they just visit a doctor and ask their questions, but that's not the case. So we have to think about what we can actually, or the kind of content that we have to, or that we would like to deliver, and how we can actually prepare for it. We can't address all these things, but yeah, I think it's very, yeah, and that's what we are not, or we could do better, is to really address those questions that are relevant today. I mean, we have a lot of different and general issues. They range from all kinds of things, medical knowledge you could think of. But then if you talk to people, you kind of understand that, well, you kind of understand that it's not always what they actually would like to hear, and that you would still have to adjust your topics. There's some sound that is difficult. So yeah, for us, it's very important to think about which topics we can actually do. People are happy, of course, to have this kind of service, but in the end, the question is of how much they can really apply this in their daily lives, and this needs more practice actually, or a more constant way of doing it, and that's where we can't really help for the moment. I mean, if you think of it, we do a lecture and event series, and people have a chance to visit us multiple times or as often as they want, but still all this knowledge that we try to give to them needs to be, or they still need to be able to use it. And that's where we could actually invent other services that provide more specific trainings.
Do you think that there's I'm not as familiar as I should be perhaps on the primary care services in Germany. It seemed to me it's something I know is being explored in England, for example, the notion of health coaches operating out of the primary care teams. Is there a possibility of the university having liaison with primary care physicians and their teams?
Can you repeat the last part? Sorry, I didn't.
I was saying, is there a possibility for your service to have a liaison with local primary care teams who could carry on some of the work you were saying about helping people to practice? So if you see what I'm getting at.
I guess there is. We haven't really put more effort into establishing cooperations in this way, but it's also an issue of time. I mean, if we think about those people working in primary care and then giving them some more work to do, at least in our healthcare system, that's difficult. But I would say that we would have to be the ones who have to actively offer these kind of ideas to, for instance, primary care, and then see if we could work together. And there are certainly people who would like to do it, but it needs a lot of planning really. And so far we haven't had experience with this.
it's a resource issue, isn't it? You know, as much
Yeah.
as anything. Thank you for that. Christine, can I turn to you? I'm very impressed with the tone of your presentation and the what you're pointing to us about the fact that we are supposed to be, as professionals, are caring professionals, but also recognizing our position. It's so easy to adopt the medical model top down, patronizing approach and not recognize the needs, particularly of the disadvantaged. But my question really is the implication of what you're saying. It does involve a kind of culture shift.
Indeed, and I think we should also here highlight there are lots of people and lots of staff doing a tremendous job, really, comforting people, listening, doing the best they can. And often we hear that from patients telling, there was a certain nurse or a certain doctor or physiotherapist or whoever who really made a difference, and that should definitely be stressed as well. On the other hand, we also hear stories of people who feel that they are talked down to, that the staff was arrogant, didn't have time. One said, after it was in an American study I read, there's a quote where the patient said, I didn't understand what the doctor was telling me. I felt stupid when I left. And I just think that's so wrong. We should not have a system where we stupefied people. So,
Quite.
so that's where I call for transformation, and asking our colleagues working very hard in the system. They also tell about system stress, that they are pressured by regulations, by time limits, by lack of resources. So these, I think, are the means we should focus on. How can we ensure that there is time enough? How can we ensure that there are training resources for people professionals who would love to train their communication skills? How can we update all our material to support the work that we want to do? So that I think is the challenge, to really make a system analysis and see where are the barriers, how can they be lowered, and asking for the advice from the people that we serve in that regard.